Hello, good afternoon. We've met again for another interesting episode of your favorite oral health. Today we'll be looking at a very interesting topic. I'm sure we've all heard that the mouth is the gateway to our body. And then we've also heard the saying that the mouth is the mirror of the body, meaning the mouth reflects what the body is. These sayings are actually very true. It is true on two counts. One, whatever that affects the oral cavity affects other parts of the body. So one can get either lungs, heart, or brain diseases by getting an oral health problem. Similarly, when you also have problem with any part of your body, being it lung, being it systemic, being it brain, it can also affect your mouth. So it is two-way affair. You don't take good care of your mouth, you have a problem. And if you don't also take good care of your body, you have problem in your mouth. So let's look at it. Today we'll be looking at what the mouth actually reflects or what the mouth actually says about the body. So one, we are looking at anemia. When you have anemia, your mouth actually says something. Your tongue and then the oral mucosa becomes pale. And once it is pale, it's a provisional diagnosis for anemia. It gives a clue. So that is one sign. Another is the yellowness of the tongue. When your tongue or your oral mucosa becomes yellow, it communicates on that is jaundice. And this jaundice could be an underlying cause. Either you are suffering from yellow fever, it could be liver problem, and even in children, we have the physiological jaundice. And this tongue or your mouth is telling you that there is something wrong with the body by showing the yellow coloration. Let's also come to other systemic conditions. It could be malaria, typhoid, it could be any disease at all. There's also an oral manifestation, that is loss of appetite. So you realize that you will not be able to eat as you're supposed to eat. Somebody will say that I have bitterness in my mouth. These are all oral manifestation of systemic condition. Then we also move to dryness of the tongue. We'll be looking at some, but this one, if you have any condition around your head and neck, which requires the use of radiation in treating the radiotherapy, they normally cause dryness of the mouth because the major salivary glands will be compromised during the process, and then the salivary output will be less. And this dryness can actually lead to a lot of complications, including caries and even difficulty in swallowing food. Let's also come diabetes. When you have diabetes, one of the areas that is mostly affected is the gum. The gum becomes bright red and easily bleed upon the least provocation. So even though it's diabetes, it has its own oral manifestation. Then we have what we call complex spot in measles. The early stage of measles formation, we see this spot, the whitish spot in the mouth. Complex spot telling you that the person is having measles. So that is an oral manifestation of measles. Then we have leukemia. All of us have heard of it one way or the other. The gum actually grows bigger and then bleeds easily. Sometimes there's unexplained gingival bleeding, telling you that there is something actually wrong with the body. Then we also have HIV/AIDS. HIV/AIDS, one of the places that the AIDS easily manifests is the mouth. You know, HIV/AIDS actually lowers the immune system. Once the immune system is lowered, then oral thrush can easily form, that is oral candidiasis. Like we are seeing here, that's the whitish coating we are seeing in the mouth on the tongue. And this can easily be wiped away by gauze or any other thing. So seeing a widespread oral thrush can suggest, or it's an indication the person has a low immune system. And it could probably be HIV/AIDS. Then we'll talk about pregnancy. Pregnancy has a whole lot of oral manifestation. So we're looking at some of the oral manifestations. One is hypersalivation, where the women will see them, they'll be spitting around because there's an increased output of saliva, then they'll be spitting. Then we also have the nausea, where they will be having the feeling of vomiting. So we have that feeling, which is oral manifestation. We have the vomiting itself, the morning sickness, which occurs within the first 3 months of pregnancy. Then we have the gum overgrowth or the gingival bleeding, the gingivitis. We spoke about it the last time, where almost 8 out of every 10 pregnant women go through if they have oral issues. Then we have this one we spoke about it, which is the pyogenic granuloma or pregnancy-induced epilepsy. This can also occur during pregnancy, and they are all oral manifestation. Then we also have drugs. A drug like antihistamine, example is the cetirizine, the rising. We also have the chlorpheniramine, etc., etc. These antihistamines actually reduce the salivary flow and then causes the dryness of the mouth. Even though you are taking some of these drugs, they have effect on the mouth by reducing the salivary flow. So you could see the dryness of the tongue here. Then we also have the calcium channel blocker, which is an antihypertensive drug, the nifedipine, the amlodipine, etc. They can actually cause the gingival overgrowth in some people, not everybody actually. So you can speak to your physician about it. Then phenytoin, antiepileptic drug, they all have effect on the gum. They cause the gingival enlargement. So the calcium channel blocker and the phenytoin have effect on the gingival enlargement. Then we also have the Stevens-Johnson syndrome, which is actually an adverse effect of certain drugs. And the classical ones are the NSAIDs. The NSAIDs, I'm talking about the brufen, the diclo, the aspirin. So some of their adverse effects will be the Stevens-Johnson syndrome. Then we have the sulfonamide. The sulfonamide are the sulfur drugs. They can also cause this kind of Stevens-Johnson syndrome. Then we have some antibiotics which can also cause. How does the Stevens-Johnson syndrome manifest in the mouth? It manifests in the mouth through ulceration of the mouth. So you see that all the lips becomes sore. So this is the manifestation of the drug in the mouth. Then we come to malnutrition. Malnutrition has several branches and it has several manifestations in the mouth, but I'm just zooming down to a few of them. We have this one, which is the angular stomatitis or the angular cheilitis. This one happens when there's a deficiency of riboflavin, which is the vitamin B2. Then we also have the aphthous ulcer. Aphthous ulcer could be caused by stress, and normally we say the cause is unknown, but malnutrition also predisposes one to aphthous ulcer or aphthous stomatitis. Then we have the vitamin C or ascorbic acid. The deficiency is scurvy, which is the gum bleeding. Then we also have micronutrients such as the fluoride and then calcium. They actually strengthen the teeth tissue. So if they are deficient, then dental caries can easily occur. That is why we advise you to normally brush with fluoridated toothpaste, because fluoride plays a key role. Then again, iron deficiency anemia, which is caused by malnutrition. Either it is folic acid or whatever related anemia. There is paleness of the tongue, which is an oral manifestation of this malnutrition. So now it is clear to all of us that the mouth actually reflects the body, is the mirror, and whatever that happens in the body can be seen in the mouth. If you open your mouth to somebody else, a professional, an oral health professional, they can actually suggest 1 or 2 things that is wrong with the body. And now we all know. The next lecture will be on what actually affects the other part of the body if you have problem with your mouth. Thank you so much for your rapt attention.